Hi everyone. So today I wanted to talk to you about pelvic pain after you've given birth. It's very common for there to be quite a few adhesions. Even if you've had a vaginal birth, there's going to be tightening and strain, of course, on the pelvic floor muscles as well as these accessory muscles in the abdomen, hips, lower back, and of course the pelvic floor area. So I wanted to give you a couple of exercises that you can do after you've been cleared by your doctor for physical activity that you can do to relieve the pain. All right, one of them is called child's pose. And I prefer, scoot back a little bit more, I prefer the wide base child pose. So my toes are together, you can see right here, toes are together, my knees are apart, and my bottom is touching my heels. If you can't do this, it's okay, you'll work up to it. And knees apart, and you're just gonna kind of walk your hands out and lay down between your knees, like that. And you should feel a stretch not only through your hips and the pelvis, but also your back and shoulders. So this is a good full body stretch. And I have my patients start with about a 30-second hold or 10 deep breaths. So that's the first one. I'm going to show you 3 today. The next one is down dog. And this is both a strengthening as well as a lengthening exercise. So you're going to go onto all fours here, curl your toes under, and you're going to push up and back. And I can't talk and do this at the same time. So that you would hold that for the same amount of time, 30 seconds or so. What this is doing is it causes your pelvic floor to totally relax, but your core is engaged and the accessory muscles are engaged. And then the last one I want to show you is called dragon. This one's dragon, and you can modify this if you need to, but basically it's a deep lunge. So one foot on the ground, one knee bent, and then hands on the inside of your foot here. And then just a nice deep lunge. And you really should feel that through your flexors, your abdomen, and your lower back and bottom. And then you would do that on both sides. There are modifications for this. So if you can't get all the way down, which is totally okay, you can use a block or some sort of support so that you don't have to go down as low. You can also modify by putting your knee down. So either way that works. Okay? All right, I hope these 3 exercises gave you something to start with. If you continue to feel any type of pain after you've given birth, it might be time to seek out a professional. So make sure you consult with your doctor as well or your therapist. Have a great day.